Hello and welcome. Today we're diving into a condition called radiation cystitis, a painful and sometimes debilitating complication that can arise after radiation therapy to the pelvic area. We'll explore what causes it, how it affects the body, how it's diagnosed and treated, and what the outlook is for those who experience it. Radiation cystitis, as the name suggests, is primarily caused by radiation exposure. This radiation is typically delivered as part of cancer treatment, specifically for cancers located in the pelvic region. These cancers include prostate cancer, cervical cancer, bladder cancer, rectal cancer, and uterine cancer. The radiation therapy, while targeting and destroying cancer cells, can also damage the healthy tissues of the bladder, leading to inflammation and a range of other issues. The pathophysiology of radiation cystitis is complex. Radiation damages the bladder lining, called the urothelium, as well as the small blood vessels that supply the bladder. This damage triggers inflammation and can lead to several problems. The damaged urothelium becomes more permeable, allowing irritants in the urine to penetrate deeper tissues. The damaged blood vessels can become fragile and prone to bleeding. Over time, fibrosis, or scarring, can occur, making the bladder less flexible and reducing its capacity. In severe cases, fistulas, or abnormal connections, can form between the bladder and other organs, like the vagina or rectum. Unfortunately, exact epidemiological data for radiation cystitis can be challenging to pinpoint. This is because the incidence varies depending on the specific type and dose of radiation used, the area treated, and individual patient factors. However, it's estimated that anywhere from 5 to 20% of patients undergoing pelvic radiation will develop some degree of radiation cystitis. It's also important to note that symptoms can appear acutely, within weeks of treatment, or develop chronically, months or even years later. The signs and symptoms of radiation cystitis can significantly impact a patient's quality of life. Common symptoms include increased urinary frequency, often needing to urinate very frequently throughout the day and night. Urgency, a sudden and compelling need to urinate. Dysuria, which is pain or burning during urination. Hematuria, or blood in the urine, which can range from microscopic amounts to visible clots. Pelvic pain, which can be constant or intermittent. Incontinence, or the involuntary leakage of urine, and in more severe cases, even bladder spasms. Diagnosing radiation cystitis typically involves a combination of methods. The first step is a thorough medical history and physical examination. The doctor will ask about your radiation therapy history and your specific symptoms. A urinalysis is usually performed to check for infection and blood in the urine. A cystoscopy, where a small camera is inserted into the bladder, allows direct visualization of the bladder lining to assess for damage. Imaging studies such as CT scans or MRIs may be used to rule out other causes of your symptoms or to assess the extent of bladder damage. In some cases, a urine cytology may be performed to rule out recurrent cancer. While radiation cystitis isn't typically classified into distinct types, it can be described as either acute or chronic. Acute radiation cystitis develops within the first few months after radiation therapy, while chronic radiation cystitis occurs months or even years later. The symptoms and severity can also vary significantly from person to person. Treatment and management of radiation cystitis focuses on alleviating symptoms and preventing complications. There's no one-size-fits-all approach, and treatment is often tailored to the individual's specific symptoms and severity. Conservative measures include pain medication, such as NSAIDs or opioids, to manage discomfort. Bladder irrigation with saline solution can help remove clots and debris. Medications to reduce bladder spasms, such as anticholinergics, may be prescribed. Dietary modifications, such as avoiding caffeine and alcohol, can help minimize bladder irritation. For hematuria, medications like aminocaproic acid or tranexamic acid can help reduce bleeding. More invasive treatments may include hyperbaric oxygen therapy, which involves breathing pure oxygen in a pressurized chamber to promote healing. Fulguration, a procedure that uses heat to cauterize bleeding areas. And in severe cases, surgery such as bladder augmentation or urinary diversion may be necessary. Preventing radiation cystitis starts with careful planning of radiation therapy. Techniques like intensity-modulated radiation therapy at IMRT and image-guided radiation therapy IGRT help to precisely target the cancer while minimizing radiation exposure to healthy tissues. Good hydration during and after radiation therapy is crucial to dilute urine and flush out irritants. Pelvic floor exercises can help strengthen the muscles that control bladder function. Medications, such as amifostin, may be used in some cases to protect healthy tissues from radiation damage. It's important to follow your doctor's instructions carefully and report any symptoms promptly. The prognosis for radiation cystitis varies depending on the severity of the condition and the effectiveness of treatment. Many patients experience significant symptom relief with appropriate management. However, chronic radiation cystitis can be a long-term condition that requires ongoing care. Recent research is focused on developing new and more effective treatments, including stem cell therapy and gene therapy, to repair damaged bladder tissue. Scientists are also exploring ways to predict which patients are at higher risk for developing radiation cystitis, so that preventative measures can be implemented early. Ongoing research offers hope for improved outcomes and a better quality of life for those affected by this condition. Thank you for joining us today. We hope you found this information helpful.